If everyone's ready, I'm gonna go on mute, and Kai, if you want to start the webinar.
Yes, let's get started.
Let's do this. Hello, everyone joining. Thank you so much for joining Congresswoman Nikema Williams' virtual town hall for Reproductive Freedom Day of Action. We are delighted that you tuned in for today's conversations. We're going to give people a few minutes to hop into the room. And while we do, I just want to review a few technical notes. So if you have questions for the Congresswoman or any of our panelists, we're going to hold questions until the end of the webinar, but please drop them in the Q&A as you have them. We'll hold all questions to the end, and we're getting ready to set up to stream this live to Facebook. So for folks who are going to tune in on Facebook, we're going to let them put questions in their chat, and we've got someone monitoring the chat so we can keep that moving. Thank you all again. There's a lot of things that you could be doing on this Friday afternoon, but our reproductive freedom is very important. So we want to make sure that you all get what you need and let us know what you are thinking as well. Again, it looks like we are now live on Facebook. Hello, everyone. Welcome to Congresswoman Nikema Williams' virtual town hall for Reproductive Freedom Day of Action. We're delighted you're tuned in. We're going to give folks a few more minutes to get started, get a few more minutes to get that title slide back up. But while I'm at it, reviewing a few technical notes. If you have questions to the Congresswoman or any of our panelists, you can drop them in the Q&A. We're going to hold all questions to the end. And if you are tuning in on Facebook, drop those questions in the comment section, and we have someone who will make sure that we can see those questions and address them at the end. So let's go ahead and get started, y'all. Again, this is Congresswoman Nikema Williams, virtual town hall in honor of Reproductive Freedom Day of Action, which is in recognition of Women's Equality Day, which is coming up this Saturday. We have a great conversation lined up for you today, some great panelists here, and of course, our fearless and wonderful leader, Congresswoman Nikema Williams. We're going to hold all questions to the end, but let's go ahead and get things started. So it is my pleasure to introduce you to our host for today. Like I said, a fierce leader who's been on the front lines for reproductive freedom, to be clear, long before she became a member of Congress. The Congresswoman from Georgia's Fighting 5th Congressional District, Congresswoman Nikema Williams. The floor is yours.
Hello, everybody, and thank you for joining. I am Congresswoman Nikema Williams, and it is my honor to serve Georgia's Fighting 5th Congressional District. I'm also very proud to be the vice chair of the Democratic Women's Caucus and a member of the House Pro-Choice Caucus, the largest pro-choice caucus ever in the United States Congress. So protecting our reproductive freedom is always at the top of my mind. And more than that, as Amber mentioned, before my service in Congress, y'all, I was on the front lines with Planned Parenthood Southeast for 10 years. I served as the vice president of public policy in Alabama, Georgia, and Mississippi. And I will always carry with me the stories that I heard from people we served about just how hard they had to fight to get the essential abortion care that they needed. And this was long before last year's devastating decision in Dobbs. And it pains me to see how much progress was undone so quickly by the Supreme Court when they decided to overturn Roe v. Wade. We've watched our ability to make decisions about our bodies, our lives, and our futures slip away. And even worse, we've watched as the maternal mortality rate, especially for Black and Brown women, y'all, it continues to rise. Georgia ranks a distant 50th in the country for Black maternal mortality. That means more Black women die within 1 year of childbirth in Georgia than in developing countries. And y'all, it doesn't have to be this way. I will always fight for legislation and policies that ensures that everyone can access the health care that they need and deserve, including abortion care and birth control, no matter their zip code and no matter their bank account. A few months ago, I co-led two pieces of very important legislation, the Abortion Justice Act and the Right to Contraception Act. These bills would provide desperately needed federal protections for what are essential healthcare services. And that's not all. Last year, I also co-sponsored Congresswoman Lauren Underwood's transformative Momnibus bill, a comprehensive policy approach to the maternal health crisis. Within the Momnibus, I'm leading the Tech to Save Moms Act, because we know that innovation and increased access to telehealth can help us close the gap in maternal health care. It may seem impossible in this climate right now to get critical legislation like this across the finish line, but in the words of Nelson Mandela, it always seems impossible until it's done. So in the meantime, we know that our communities need care and access now. And even in our current landscape for reproductive care, there are resources available to you and people working for you. So today, I've invited a few of these warriors to join me in this important discussion. First, I'd like to turn the floor over to Melanie Fuentes-Rayner, Director of the Office for Civil Rights with the U.S. Department of Health and Human Services. Before joining the Biden-Harris administration as counselor to HHS Secretary Xavier Becerra, Melanie served as the special assistant to the Attorney General and Chief Healthcare Advisor at the California Department of Justice. There she worked to protect the Affordable Care Act. Director Fuentes-Rayner, the floor is yours.
Thank you so much, Congresswoman, to you and your staff and to this panel. We were joking before we got started about my lack of pink today, of which I have many post-Barbie, but I missed the opportunity to be in the cool kids. But all jokes aside,
we'll have more opportunities.
Thank you for inviting me to speak with you all today about the work in our office, the work of the Biden-Harris administration that we're doing to support and protect the rights of women, patients, access to reproductive health care across the country, as well as protecting their privacy when accessing health services. At the top, I want to reassure you, in the face of care bans, challenges in accessing care, including abortion care, that you all know were happening long before the Supreme Court overturned Roe, that the Biden-Harris administration sees you, we stand with you, and we are doing everything we can to ensure that you have a voice and can access care. I know that providers are experiencing challenges in providing care that I will never understand. My staff and my office have done listening sessions across the country in response to President Biden's 2 executive orders, which asks us to both remotely and in person do listening sessions with providers and advocates and patients across the country. We've been in places like Alabama and Texas and Louisiana. I've been in Atlanta. So we continue to have these conversations to make sure folks, even when they have these bans in place, that they have a voice and that they feel seen by the administration and the federal government. Before we delve into specifics, I want to take a little bit of just a primer on my office. My office is nationally situated. I have staff and an office in Atlanta, Georgia, as well as offices in 10 other cities across the country. My office not only does civil rights work, which is a heavy mandate and such an important thing to work on at this moment in time, as healthcare is at the front end of our civil rights. My office also enforces our nation's health information privacy laws. Together, our civil rights laws prohibit discrimination on the basis of race, color, national origin, sex, age, and disability in programs and services. And we work with advocates and community across the country to help educate people about their rights. You all know the day the Dobbs decisions came out, HHS immediately responded in a way that the federal government hasn't before. President Biden signed not 1, but 2 executive orders. HHS launched reproductiverights.gov, where there is fact-based neutral information for providers and patients about accessing care, family planning options, making sure you understand your rights, and other things. So that website has been up since hours from that decision, which overturned Roe. My office also, in response to what was happening at the Supreme Court, did some steps. So we like to remind folks that there's a lot of misinformation about what HIPAA, which is our health information privacy law, does and does not protect. We regulate providers and insurance companies and data clearinghouses, but a lot of the things on your phones and your tablets we don't regulate. And so we put out a guidance pretty quickly, making sure folks understood that sometimes having protected health information on your tablets or devices is not recommended. Taking steps to make sure you're protecting your privacy, considering not downloading free apps, using end-to-end encryption, not keeping protected health information on your devices, understanding that in this day and age, your information is really valuable and can be used in ways in which I don't think we previously contemplated. My office also issued a guidance making sure that covered entities, so whether it's a hospital or a provider or a health insurance company, that they understand the HIPAA privacy rule permits when certain conditions are met, but does not require that protected health information be disclosed to law enforcement. The guidance goes into specific examples. Again, HIPAA applies to small, medium, large providers. And so we want to make sure that those medium and small size providers have information so that they understand what the law does and does not require. And they're thinking about these things before they have a situation in real time where they have to make a determination of what to do with protected health information. And last but not least, my office in July of last year, after hearing reports, or rather this year, after hearing reports of patients unable to access necessary medications, largely in response to what was happening in the Supreme Court, HHS issued guidance to roughly 60,000 US retail pharmacies, clarifying their obligations under federal civil rights laws to ensure non-discrimination on the basis of sex, which can include pregnancy or disability. Establishing a specialized process by which we reviewed and took into consideration national chain pharmacies across the country, we were able to come up with an agreement with both CVS and Walgreens, where they now have specialized teams to provide internal guidance and respond to complaints about commonly prescribed medications at the pharmacy level, where they launched new trainings on reproductive health care to guide pharmacy team decision-making and interactions with customers, creating direct paths for customers to submit complaints about commonly prescribed medications, such as those that we saw in the disability community being denied access because of what was happening in the courts, monitoring denials of medication and taking corrective action when they see trends, and implementing policies and procedures to evaluate potential accommodations where pharmacies can do a better job at dispensing medications. So these are just some of the things we've done. We've now hosted over 22 convenings nationally. We've been in multiple states across the country where healthcare is banned. We continue to do this work. We are a law enforcement agency, so you can file complaints with our office. And we can talk a little bit more about that in the discussion, but I just want you all to understand you do have rights. Even if you live in a state where care is banned or restricted, you continue to have federal civil rights, and you continue to have rights about your protected health information. So I appreciate the opportunity to be here today, Congresswoman, and I will yield the cue.
Thank you so much for being with us today. Next, I want to introduce Sarah Sullivan. Sarah Shea Sullivan serves as the program director for the Family Health Centers of Georgia's Family Planning System program, the only fully integrated Title X family planning program in the state. She's been with GFPS since its inception in 2014. With a background of 15 plus years in sexual and reproductive health, Sarah utilizes her expertise to manage all aspects of the program, including ensuring compliance with federal and state regulations and leading service expansion throughout the state. The General Family Planning System serves 157 of 159 counties in the state of Georgia and is a true lifeline for some of our most marginalized communities. Sarah, thank you so much for joining us, and the floor is yours because now I need to know which 2 counties aren't being served.
Thank you, Congresswoman. And we actually serve anyone in all counties. So anyone who is in need of services. Again, thank you for inviting me to be a panelist today. I'm really excited. One of the joys of my role is to amplify the work of our network. So just a brief overview of our network. We are a network of 29 health agencies. 25 of those health centers are federally qualified health centers, community located health centers all throughout the state. We also have Grady Health net system in our network, and then 3 other community health centers that provide mostly specialized services, HIV services for STD, substance abuse, that sort of thing. But as I said, we serve anyone and everyone in all counties all over the state. What makes our network very special in the Title X space is that we are the only network that fully integrates family planning into primary care. And what that means to patients is that no matter where you go into one of our federally qualified health centers, into one of Grady's ambulatory sites, or into one of the community health centers, you actually have access to comprehensive family planning services. And that means you have access to pregnancy planning and prevention services, which otherwise you might not have. Typically in a family planning health center, you might only have access to pregnancy planning and prevention services. But what makes us unique again is that we provide a whole host of holistic health services, from pediatric care to primary care to adult med, internal care, behavioral health, mental health, vision, dental. There are a whole host of other health services that are available to folks through our centers. And that really is one of the hallmarks and one of the wonderful things about our network. We also provide those services, and I think this is a really key point to, as I said, anyone who wants and needs them, but also those folks who are underinsured, uninsured, insured, regardless of their income, and regardless of residency status, which I think is really important. It doesn't matter if you are not a citizen. It doesn't matter if you are not a resident of Georgia. If you need to access services, family planning services, you can come to one of our health centers and we can support that for you. So again, thank you so much for inviting me to be a part of the panel, and I'm going to yield back.
Thank you so much. So y'all heard that it's not 157 out of 159. Everyone is being served. Next, we will hear from, continuing on the healthcare conversation. Next, I'd like to introduce Dr. Natalie Hernandez-Green, the Executive Director for the Center for Maternal Health Equity at Morehouse School of Medicine. Dr. Hernandez-Green has more than 17 years of research experience and is the founding director of the Center for Maternal Health Equity at Morehouse School of Medicine. Dr. Hernandez-Green is an NIH-funded researcher focusing on eliminating women's health disparities. So as we continue to see headlines about the increasing maternal mortality rate, we desperately need the work of Dr. Hernandez-Green now more than ever. The floor is yours.
Thank you so much, Congresswoman. I'm just really excited to be here and really talk a lot about the work that we're doing at Morehouse School of Medicine. For people that are not aware, Morehouse School of Medicine is a historically Black medical school. And since our founding more than 45 years ago, our primary mission at Morehouse School of Medicine is to increase the number of Black health professionals in our country. Embedded within Morehouse School of Medicine is the center that I lead, and that is a passion of mine. It's our Center for Maternal Health Equity. In 2019, the Georgia policymakers decided that they wanted to focus on maternal health inequities and appropriated some funds to establish the Center for Maternal Health Equity. Our mission is to pursue equity in maternal health by reducing maternal mortality and morbidity, not just locally, nationally, but also globally. And our vision is really to end health inequities across the lifespan and inequities in women's health across the lifespan. And we do this in 3 different ways. We are an academic institution. A big goal or area of expertise for us is research. And we do it from very basic science, where we have investigators such as Dr. Erica Johnson, who's investigating the impact of race and transgenerational stress and discrimination trauma, and looking and examining placentas and how that's impacted, all the way to population health, which myself I am. And I have been examining things related to perinatal workforce and different population health issues. Additionally, we do a lot with community. The community is at the core of who we are at Morehouse School of Medicine. And so we see ourselves as an information resource hub. We make sure that information is in plain language and is accessible to the communities that need it. We also partner a lot with national and community-based organizations. We know that the communities are at the helm and are doing amazing work. What we want to do is build capacity and that data to ensure that communities are sustained and continuously funded. And then we also take a lot of the information from our research and our training to inform policy and work with communities around health advocacy. And then lastly, as a medical school, we're in the business of training health professionals. And so with the center, a lot of our training modules and training programs that we do are specific to maternal health. And so we have developed a respectful maternity care training. We created a community-based perinatal patient navigation program, which I'll talk about a little bit later. One thing that we're really excited and we found out just last week is that we are one of the 12 maternal health research centers of excellence. I'm proud that Georgia was selected among these 12 centers across the country. Our center is really focused on reproductive justice and behavioral health among Black pregnant and postpartum birthing people. And this is a partnership between us, Emory, but most importantly, a robust network of community partners. And our mission is to help Black women survive and thrive by translating maternal behavioral health research and intervention into multi-layered actions with community. And we do that with community-driven research and interventions to support Black women's health, thus helping to end longstanding neglect of these crises of mental health and the legacy of excluding Black women from related research. So I thank you for the opportunity to talk about our center and looking forward to engaging in more in-depth conversation. Thank you, Congresswoman.
Thank you so much, Dr. Hernandez-Green. And finally, y'all, I want to introduce you to Angela Ina, co-founder and executive director of Black Mamas Matter Alliance. Ms. Ina works to convene Black maternal health professionals and community-based organizations to develop training, research projects, and Black feminist advocacy strategies to advance change in maternity care. Ms. Ina has over 15 years of public health experience and has served as a fellow at the Centers for Disease Control and Prevention, working on Zika and pregnancy. Ms. Ina, thank you for joining us today, and the floor is yours.
Thank you so much. Thank you so much, Congresswoman. Definitely really appreciate the opportunity to speak today and to speak of the wonderful work that we have been doing at Black Mamas Matter Alliance for several years now. For those that may not know, the Black Mamas Matter Alliance is a national network of Black-led and Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, respectful maternity care, and the human rights framework in order to ensure that all Black mamas have the rights, respect, and resources to thrive, not just survive, but thrive before, during, and after pregnancy. Our alliance includes a diverse range of professionals from midwives of all licensed backgrounds and doulas to OBGYNs, nurses, lawyers, academics, and public health researchers, and even artists. Our mission is to center Black mamas to advocate, drive research, build power, and shift culture for Black maternal health rights and justice. At BMMA, we approach our work through the goals of working to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes. We also work to cultivate research that leverages community knowledge and Black scholarship. We work to advance care, specifically by promoting holistic, respectful, and comprehensive and full spectrum maternal and reproductive health approaches to Black mamas care. And we also work to shift culture by dismantling negative narratives on Black motherhood and amplifying the voices and experiences of Black mothers, whether they have given birth or not. As efforts to address maternal health inequities in the United States continue, we believe that we must be more intentional about centering the ingenuity and the work of Black-led maternal equity initiatives across the country and globally that are making a difference. And so one of the ways that we are calling for some systemic changes is that after many years of working together as an alliance, we have identified some key maternal health issues and began working on building consensus around recommendations. And so we were so excited to finally launch our comprehensive policy agenda this year during our annual Black Maternal Health Week campaign, which is entitled Black Mamas Matter in Policy and in Practice. This policy agenda outlines our policy vision for the Black maternal health rights and justice movement. We believe that we can advance this vision through collaboration across sectors, across disciplines and geographies. And there are sections of the agenda that even specifically focuses on what we're talking about today, which is the full spectrum of maternal, sexual, and reproductive health care. We are calling on policymakers to make BMMA's holistic care principles a reality through comprehensive insurance coverage, expanding equitable, high-quality, patient-centered care across geographies, and funding research and programs that center Black women and birthing people. So just a quick summary of those specific recommendations include, again, operationalizing our holistic care principles through ensuring comprehensive public and private insurance coverage, not just with maternal and reproductive health care, but also sexual health care and education, and improving access to care across birth settings as well, not just in the hospital settings, but in community-based organizations and birth centers as well. Also, we're calling for more guidance to be issued to healthcare providers, institutions, insurance companies, and related entities on providing equitable, high-quality, patient-centered care. And again, doing that necessary specific funding that will center and advance innovation in this area, and in particular, direct funding to Black-led community-based organizations to advance the work that they do and expand the model of care and approach to the work that they do in their communities for sustainability. I want to thank the Congresswoman and for the opportunity to speak today about one portion of the work that we do here at BMMA. Thank you.
Thank you so much. Y'all, I wanted to make sure that we brought all of our guests together because this topic is very critical and at the top of people's minds. I hear from constituents all the time asking where they can go for resources, where they can go for support. So now I'm going to bring all of our guests to the screen to turn to some of the questions that have been submitted by the audience. Remember, if you have questions, put them in the Q&A box on Zoom and in the comments on Facebook. So while you're getting your questions in, I'm going to kick us off with a few that we've received from other people along the way. We're going to start with one question per panelist, and we will continue to go through as time permits. So I know that you ladies have answers, and I am ready to get started. This question is for Director Melanie Fuentes-Rayner. Can you tell us more about the federal protections that many patients might not be aware of? There's a lot of misinformation out there, so it'd be good to just reiterate any federal protections that patients might not be aware of.
Yeah, so we talked a little bit about this when I opened up. You know, just because you live in a place where healthcare is being banned or restricted doesn't mean you don't have federal civil rights laws. And that can mean a lot of different ways, right? It might mean you go to a doctor's office or you go to a hospital and they're unwilling to translate things into the language that you speak, or they're unwilling to give you an interpreter or a translator to help with an effective communication because you are mobily or visually impaired. So reminding folks that these things continue to exist even in a post-Dobbs reality, and making sure that folks understand that you continue to have rights. Post-Dobbs, which overturned Roe, we heard a lot of stories and complaints that were filed to our office where women who had been on drugs like methotrexate or misoprostol for disability purposes, whether it was chronic arthritis or rheumatoid arthritis or ulcerative colitis, that then they were suddenly being denied these drugs or delayed in getting these drugs when they were going to pharmacies. And, you know, a lot of that I think was just a lot of confusion and folks just taking it upon themselves to make determinations about people's healthcare without necessarily thinking about the law or the patient. And so, through complaints that were filed with our office, we did a investigation of national chain pharmacies. We've come to terms with really, I think, pretty good outcomes of both CVS and Walgreens to help increase patient visibility in terms of their rights, options for patients when they might be denied something at a pharmacy, and making sure just that there's a basic training in place for pharmacists, understanding that this is a difficult time to be a provider. We also remind folks, right, that your health information privacy has rights. And I've heard stories across the country, one of which I've heard in places where reproductive health care is being restricted or banned, including an abortion ban. Patients and providers telling me that suddenly a hospital or a provider won't give them their medical records so that they can go see another provider. That is a cornerstone of HIPAA. You have a right to your information, a right of access to your data. If that's happening to you, you should file a complaint with my office. My office, we have a physical location in Congresswoman Nikema's district. You can file online, but again, that's a cornerstone of your right. And also making sure that providers understand, just because Dobbs happened doesn't mean that the law changed. A disclosure of your protected health information is permissible. It's not required. So providers have some discretion in this, and there's rules around in which when they are disclosed, they have to follow within those permissions. So we just like to remind folks of these things because, it's been over a year now since this decision, I think, ripped out the bottom of, I think, what we've all perceived to be a right. And I want to make sure that folks understand you continue to have rights to your data, you continue to have rights to your information, you continue to have rights as a person in this country, and making sure that folks have visibility and know what to do should those rights, they feel like they're being violated because they're pregnant, because they have, they identify as trans, because their sexual orientation is different, because they have a disability, right? Because you're a Spanish speaker. You continue to have rights. And so that's a big commitment from this administration. And we're trying to do all that we can to bolster and shore those up. And I'm sure we'll have future opportunities to work with Congresswoman Nikema's office in this space, but really appreciate the opportunity.
No, thank you so much. And with that question, I have a follow-up that we received. And so just to paraphrase, reaching out to the HHS Office for Civil Rights, it kind of sounds like a big step and a big deal. And some people might be intimidated just by the title because y'all are important people on the Zoom today. So we talked about some office not giving you your medical information, but what are some other things that people might not know to reach out for? Can you give us some examples or guidelines to help establish when it's time to file a complaint?
Yeah, so our office has federal civil rights authority over disability, age, sex, which includes sexual orientation, gender identity, and pregnancy-related conditions, conscience, or religion. And in those instances, if you feel like you're being denied something or you're being discriminated against, you should consider filing a complaint. You can file a complaint at hhs.gov/OCR/complaints. It's a crappy website. I'm sorry. It's not a better URL. It's the government. However, reproductiverights.gov, which is easier to say and pithier, you can just go to that website. There's a whole Know Your Rights page on that website where it tells you how to file a complaint. So if you remember one thing today, remember that website. But yeah, I mean, I think making sure you have access to your medical records, those are things that my office does all the time. We've gotten a couple of complaints around impermissible use and disclosure of protected health information. And so we're trying to do a lot of education with providers so that providers understand it's not just, somebody walks in and you have to hand over data. There's rules in place. We have a proposed rule that would even go further and would prohibit certain use and disclosures related to reproductive health because of what we're seeing on the ground right now across the country. And so we're working on that rule, which I think would really bolster your privacy. Making sure that, just because you have a disability and you happen to live in a place where abortion is banned, it doesn't mean that you can no longer get your methotrexate or misoprostol. These are non-abortion purposes for which you're taking the drug for a lawful condition, a lawfully prescribed prescription. Making sure that you have information so that when you go to the pharmacy, you're informed and you're empowered. Understanding, right, that, based on complaints, we've seen instances where pharmacists are announcing to people online, right, this person has this condition, or this person is seeking this kind of drug, and making sure that they're also following HIPAA and protecting your privacy when you have those instances. Those are the kinds of complaints where you should be filing a complaint. And I get asked a lot, I don't want to file on my own. What should I do? You can, I'm sure you can go to the Congresswoman's office and they can work with us. You can work with advocacy organizations like Black Mamas and others that will help you get to us. Or you can just call one of our investigators and their information is up on our website, and we have an email account and we have a phone line. So, just because you don't want to file a complaint, but it happened to you, it might have happened to somebody else. And so you sharing that it happened to you could be helpful to us. If you think it's something more systematic you're seeing or hearing, especially providers, please give us a call. We, for example, I was thinking about this when Angela was speaking. We're investigating, it's public, we're investigating a hospital system in Los Angeles where a Black woman died during childbirth. We had a complaint filed, but we also just opened our own compliance review based off of the news. And so that's really significant in my office, right? Because you can be discriminated against based off of your race and national origin. And so we're looking into that. And we've had a couple of other complaints filed in other states where we've seen pregnant women being treated differently because of their race or because of their status. And so it's really important to use your voice, and we'll continue doing things to help policy-wise so that it's much stronger for you to be able to use that voice. And so I think those are just some of the things and ways in which you might be able to protect yourself.
Thank you. Thank you so much for all of that information. We will, I'm sure Amber has been thinking of ways to get those websites out so that people can read them and copy them and write them down, because we want you to utilize the resources that are available to you. The next question is directed to Sarah Sullivan. As the only Title X family planning network, your system serves everyone and fills a critical gap for the most marginalized communities as you provide care. Are there gaps in access that you see that we need to address, and what steps do we need to be taking?
Yeah, thank you, Congresswoman. So I do like to look at gaps as opportunities. And if you know anything about Georgia, we have lots of opportunities.
Lots of opportunities.
So
but the good thing is we're in this together. So
that's right. That's
brainstorm
right.
and get it done for the people.
It takes the whole village.
That's right.
So I'll just address two of the areas that kind of rise to the top for our network. One of them being the provider shortage in Georgia. There is a provider shortage here in all aspects, in all areas. And just to be very, very specific, so of the 159 counties in Georgia, 82 of them lack an OBGYN, right? 90 of them lack a psychiatrist. And so I think it speaks to the challenge of folks being able to even access basic services all throughout the state. I was recently in Twiggs County, which is outside of Macon, and in our provider network, we have a OB who is the only OB in that county. And so she's not only providing those services, but she's also kind of serving as a family practice physician as well. She knows that when women are coming to her, she may be the only one that they see. And so this is happening all too often throughout the state. And so in terms of solutions, I don't have a great solution beyond that. There need to be some innovative strategies to address that. And I think, our panelists know better than I about pipelines and how to, galvanize a workforce, but we need something desperately in Georgia. And then that second area of access is related to transportation. Again, in our rural sites, if you don't have locations where people can be seen, people are traveling an hour, hour and a half outside of their home area, just for basic services. And Congresswoman, you mentioned telehealth. Telehealth is a great option for a lot of these individuals. The challenge and the opportunity that exists in Georgia is infrastructure. And so as we think about these innovative solutions and new solutions, one of the things we have to work on is infrastructure and funding that and ensuring that things are in place for us to be able to provide these telehealth services. One of the great things about our network is that with our FQHCs, many of them have mobile health units that they're using creatively. Several of them are using telehealth for not only family planning services, but other primary care services. So that is wonderful. We've even had sites that have contracted with transportation services that will take their patients to and from homes for their visits and not just drop them off and, hope they get picked up. They literally will sit there and wait for the duration of the visit so that folks know that they can trust that they'll get back home. And so another unique solution was during COVID, one of our sites in South Georgia was able to start home visits, and these are just some really creative ways that our network is able to kind of fill those gaps and pursue those opportunities to serve folks throughout the state. And I think there definitely needs to be a lot more of that.
Thank you. Thank you. Your story and talking about how many counties don't have medical providers reminds me of Dr. Karen Kinzel down in Clay County.
Yes.
Dr. Kinzel provides services more than just Clay County, but she's the only doctor in Clay County.
That's right.
And I remember having a conversation with her and she was providing services in an old Tasty.
That's right. It's a
building.
Tasty Freeze. She's in our network.
Freeze building. And she is a lifeline to the people in that region. And we were talking about maternal health disparities and how why our numbers are what they are. And Dr. Kinzel is like, she is not an OBGYN, but if you come to her, she's going to do what she can to get you the services and the care that you need. So, I mean, I guess it's innovation, being creative, but even the Tasty Freeze can go there and get medical services. Where there's a will, there's a way, y'all.
That's right. That's right. Absolutely.
And just to follow through that, though you're the Georgia family planning system, you also mentioned primary care. Mm-hmm. Can you tell us more about the benefits when patients receive care in one place?
Yeah, for sure. And I think we just talked about that a little bit. Sometimes it's out of need, out of necessity. Dr. Kinzel, Dr. Callens in Twiggs County, they have to do what needs to be done. So they are doing all the things. In other areas, like in more populous areas in Atlanta, when you have an FQHC, you just have all these different wings of care that people can access. You can literally walk into this health center and have vision services, dental services, primary care services, women's health services, bring your kids, get their peds services taken care of. But then you also have this whole complement of social services. Many of the FQHCs have dedicated staff that help support other social determinants of health. And so there's like this resource network that folks have access to. And the beauty of integrating Title X into primary care means that, again, they're not just focusing on one area of healthcare, they really are looking at a holistic picture. So if a woman comes in, whether she's pregnant, wants to be pregnant, or doesn't want to be pregnant, they're looking at, well, are you hypertensive? Are you diabetic? What do we need to do to make sure that you are healthy for whatever it is you wish to pursue, whether it's getting pregnant or not? Let's make sure that you are at the best place possible, that your health is at the best place possible so that we can serve you appropriately. And one of the other things is that mental health care piece is huge. Many of our sites do have dedicated behavioral health staff. And I think it's one of the other resources that we're able to offer is HRSA's National Maternal Mental Health Hotline. And so while we have folks on the ground, boots on the ground at the site, I think it's also really important that people know that there's also this national support right now, that if you are in rural Georgia and you don't have access to a behavioral health provider or a mental health provider, you can call this hotline and receive services through a professional counselor. They're confidential services. It's available 24/7. It's got a cute little number, 1-833-TLC-MAMA. So
See, we can remember that one.
That's right. That's right. And so I think together, working together on a national level and then at the community level is really important to really create like this, again, a resource network around patients, where, to what Angela was saying, we're centering patients and providing resources for them and not forcing them to figure out how to access these resources in different siloed systems.
Thank you. Thank you. The next question is for Dr. Natalie Hernandez-Green. What are the areas or issues that we should be focusing on to achieve the shared goal of reducing maternal mortality?
Yeah, absolutely. I mean, this is like the $100 million question, right? Like, where do you even start or how we should do it? So I think, it's a multifaceted, approach, right? We have to work and take action at different levels to reduce what we see in maternal mortality and morbidity. But I think the number one thing we need to do is really center health equity in order to reduce those disparities. Many organizations like Black Mamas Matters Alliance and others are doing great work, and we need to continue investing and partnering with them and doing real and meaningful investments, not like these Band-Aids that continue to happen in supporting our communities, because they're really the key at amplifying the voices and honoring the lived experiences of our communities and the women. The other thing is that, a lot of onus has been put on individuals and birthing people. We are portraying these narratives and we're asking them to take their blood pressure. We're asking them to do this. And it's really about structural interventions, right? We need to provide full spectrum care. We need to address the multi-layered determinants of health that are contributing to these inequities. We've seen some strong policy investments, including the expansion of Medicaid coverage to 12 months following childbirth, and comprehensive policy work and the Momnibus Act. But we need to pass these legislations, and we need to make sure that there's accountability and that things are actually being enforced and working. We need to reimagine a healthcare system that respects and values choices. And if women choose to labor in a hospital, or even giving women and birthing people the opportunity to labor and birth wherever they want and are being treated with respect and dignity. The current system we have right now was not designed to address the situation that we have on hand. One thing that we've done is to inform and work with policymakers is collect narratives of almost 90 women of color across the country who had maternal near-death experiences. And like the recent CDC report, a lot of women reported feeling disrespected, experiencing discrimination. And oftentimes we hear about race, but also their insurance status. Women who are on Medicaid get discriminated against. And hospital systems and providers can take steps to improve care and really reduce and dismantle this dismal maternal health outcomes. There needs to be greater partnerships with hospital systems and healthcare systems with community-based healthcare providers, including doulas, midwives. We've created a community-based perinatal patient navigation program at Morehouse School of Medicine, where we have people who have had lived experiences being trained as a community health worker. They're being trained as a doula and a lactation peer specialist, and they're providing the social support. They're addressing the social determinants of health that women have, and just being an advocate for them. Again, this is a Band-Aid on something that's really bigger than what we can imagine, right? Because again, we need a new healthcare system and process in place, but at least right now it gives us support. And, again, all of this doesn't have to be an or, has to be an and. Everyone has a role to play, and we all need to be working together. I think what happens too is that we're pitted against one another because, the resources that go into women's health are this small compared to what men's health gets. And so everyone feels like, well, I have to do this or I have to do that. when we all should be collaborating and leveraging the resources that we have, but we also need bigger investments in women's health. And we need it to happen before women are pregnant. In Georgia, we still have about 20% of women who do not have access to healthcare insurance coverage. That's ridiculous in a country that's supposed to value who we are. Women, I always say, we're incredible. We're talking about Women's Equality Day. We birth life, we give life. And we're at the helm of a lot of decisions and things that are happening in this country. And so we need to protect them. We need to recruit and retain diverse providers. And that's something that what we at Morehouse School of Medicine has been doing for a very long time. There's a startling statistic that the nation's 4 historically Black medical schools have graduated more Black physicians over the last 10 years than the top 10 white medical schools combined. And now we have things like affirmative action, and we don't know where this is going to happen or what's contributing or, what's going to happen in the future. And we know that when patients look like their providers, there are better outcomes. And this is scientifically proven. So, I have only a few minutes, but there are so many things that we can do. It's not a one size fits all approach. It depends on your community, the context, the policies that allow you to do the things in your particular states. And I'll just leave with a quote, because I think, one thing that we want to do is continue to amplify women's voices and their stories. And again, in coinciding with the CDC report that was a quantitative survey, ours was qualitative. One participant said, "I didn't feel," and I guess obviously wasn't believed at all. There was no understanding or concern or anything like that. It was all just brushed off. This was a patient who had HELP syndrome. No one wanted to help her. She kept crying out, and she actually went into a coma and woke up 10 days later. And then when she woke up, found out that not only was she in a coma for 10 days, but she also lost her child. And, she continued to cry out. She talked about the discrimination and, and she, often the narrative of Black women too, is that they're low income women, who are experiencing this, who come from these, poor communities. And this is a woman with means, right? We know that Black women are at the helm. Women make, good amounts of money and stuff, but yet they're still being discriminated against. And it doesn't matter, money doesn't protect you, your education doesn't protect you. It's just, racism and institutionalized racism that's contributing to this Black maternal health crisis. So again, we can create the best interventions, the best programs. If we don't address this systemically, these will all just be Band-Aids, but they have to still continue to happen because we know there are a lot of challenges when it comes to policy. But those are just a few thoughts. And I know that my colleague Angela will address a lot because Black Mamas Matters Alliance has really been at the helm of working with policymakers and really instrumental in informing a lot of the components of the Black Momnibus Act.
Thank you so much. And that is a great segue because the next question is for Ms. Ina. One of the goals of the Black Mamas Matter Alliance is to shift culture by dismantling negative narratives on Black motherhood. Can you tell us how the negative narratives impact the real life experiences of Black mamas?
Sure, and I'll actually take just a slightly different approach in terms of the focus. What I really want to raise is that at the core of our work is actually to work with, amplify, and make visible and get behind policies that support the Black maternal, perinatal, and reproductive health workforce. And I want to be really clear with that because we talked a lot today about, challenges that we see in real time here in the state of Georgia about, quote unquote, maternity care deserts, about our healthcare system, and even just the quality of care that people receive when they do seek that care. And so what we have heard years from the everyday Black mama, Black birthing people, Black birthing person rather, is really a call out for more options, more birthing options. And so what we're behind and what we want to see a change, a complete shift in the state of Georgia, we want to see effective policy that supports the expansion of midwives and midwives' scope of practice. That is a actual tangible thing that can change with the swift of a signature to expand the scope of practice for midwives. This will open up the door for more midwifery practices in a lot of rural areas. You know, there was Dr. Sullivan mentioned about one particular provider servicing a number of folks in a rural county. You know, burnout of our workforce is real. You know, there has been so much, speaking of narratives, there has been so much talk about, you know, we need more doulas, doulas is the way. But what we're doing is putting a very serious systemic issue on the shoulders of doulas. And doulas are one aspect of a larger healthcare system. So not only do we need doulas, but we definitely need midwives. And that is so desperately needed here in the state of Georgia. And we need for hospital systems to be more friendly to midwives and doulas, because this is what Black mamas and Black birthing people are saying that they want and need to navigate our healthcare system. And finally, you know, Dr. Hernandez mentioned something. These issues around obstetric violence, around neglect and mistreatment in the healthcare system is not just the experiences of folks that are low income. This is the experience, and we're seeing the negative health outcomes of people who are well insured, well educated. You see what I'm saying? So while yes, we appreciate and uplift the work and the comprehensive work of FQHCs, but we know that we need more options. We need more birth centers in the state of Georgia. Again, this is a policy issue that can be addressed. Like I said, we need more midwives who are able to practice at their fullest scope. That is a policy change that can happen in the state of Georgia. And we do need to address the issue of the fact that that what is real is that there has been hospital closures, right? We lost the Atlanta Medical Center. That was a big blow to our healthcare system. You know, again, the changes cannot be at this individual behavior change level or at this individual, oh, if we just connect them to a doula. It is very systematic and it requires policy change, and policy change that can easily happen, especially at the state level. And we believe that Georgia has a great opportunity to make that happen. Thank you.
Thank you. Thank you. And I mean, we could continue this conversation and go on and on because it's such a critical topic, but we are a bit over time. But I want to make sure that we get this last question in. If my panelists will oblige to do one last question, because it is really, really important, especially ending the way that Ms. Ina just closed us up, because these are policy decisions, y'all. We got to this point because of policy decisions, and it takes leadership to implement and propose new policies that can change this. So this last question is from Carla Stocker. What are some actionable items, example like sending an email or call your representatives on local, state, and federal level, that each person can do in their communities to help women's rights? So if everyone could give me, if someone wants to take this, I feel like I know who wants to take it, but
I can just quickly say,
I knew it.
I could just quickly say, please go to blackmamasmatter.org, learn more of our policy agenda. And then also you can go to the website of the Black Maternal Health Caucus. They have some clear step-by-step ways in which everyday citizens can get involved in terms of sending a letter and getting behind the Momnibus Act, and vote, please.
Yeah.
Vote is so important.
Yeah, I was just gonna say that, Angela. Yes, please vote. And know that it's not like you don't have to do like legislative advocacy. You can advocate on behalf of individuals. You can be an advocate for your friend who may be scared or feeling like she's, her whatever they is feeling disrespected in a certain particular situation. And also educate, as a lot of our colleagues said during this time, there's a lot of misinformation being spread. And I think, it's the onus is on us to be able to educate one another and not empower, because we have power. We just need resources and tools to activate the power that we each have. And that's being there for one another. We're in a system where people are trying to pit us against one another. And this is the time where we stand in solidarity to address an issue that should have been addressed 200 years ago.
Absolutely. Anyone else?
I'm just gonna drop one thing, and I'm just kind of gonna echo what Dr. Hernandez says and what Director Rayner said, is to the point of, you can speak on someone else's behalf. You can be that kind of advocate at a base level. Even, to Dr. Hernandez Green's point, if you don't want to spend your time figuring out all the legislative issues and Googling all the things and learning all of the stuff, what you can do is, if you see something, you can step in and work on someone else's behalf. And so that is really, really important for those folks who just want to take a very small step to help the process.
I would just add, I'm a policymaker. I work in the federal government at the Department of Health and Human Services. Many of the steps we took post Dobbs were steps that were the product of complaints filed, questions asked to my office, right? Like our pharmacy guidance was because we were getting questions from people that were asking, is this allowed to be happening to me? Or this is what happened to me. The HIPAA guidances we put out to remind providers about disclosures were the product of questions providers were asking. The EMTALA, we didn't even talk about EMTALA. We did an EMTALA guidance, right, that says abortion can be emergency stabilizing care everywhere except Texas, where we've been sued. But that was the product of conversations with patients, providers, and others. And so those questions, if it's happening to you, it might be happening to somebody else. Your experience might be a systematic thing that's happening. And also those things can influence policy and the needs, especially my office, what kinds of guidances we're putting out, what kinds of information we're putting out in rights, because that's sort of like the heartbeat of the local community and allows us to have a bigger platform to be clear about your rights and to help.
Thank you all so much. I did see one question that I'm going to answer from a constituent, Mr. Mike Schenkel. I hope I'm pronouncing your last name correctly, but he wanted to make sure that we are he appreciates this conversation today, but has many more issues that he wants to bring up. And Mr. Schenkel, I agree with you wholeheartedly, because we don't live single issue lives. We have to make sure that we're addressing all of the things. So I am glad that you joined us today as a part of this conversation, and we diversify the way that we bring information to constituents, from in-person to telephone town halls to Facebook and IG Live, to Zoom, because we want to make sure that we are reaching the most people as possible. And we know that constituents interface with our office and engage in different ways. So we will absolutely have more in-person conversations, and I look forward to having you at that conversation. And in the meantime, I need anyone who is watching here to know that I know you could be doing so many other things right now, but you being here reminds me of why I'm working so hard to secure not just our reproductive freedoms, but all of our freedoms, making sure that we are fighting for free and fair access to the ballot, as I'm back in DC today to be a part of the 60th anniversary of the March on Washington tomorrow. So any issue that you want to bring to my attention, our office is here to serve. If you have questions or concerns about legislation, you can always contact my Washington, D.C. office at 202-225-3801. And if you need assistance with any federal agency or just want to let me know what's on your mind, you can call my district office at 404-659-0116. And all of the information for today should be on the screen.
Should be coming up soon.
At some point soon.
Yay, there it is.
So the contact information for our speakers today who shared all of their expertise is right here on the screen. Thank you again for joining us, and I hope you all have a fantastic weekend.